The Hispanic or Latino population are growing very rapidly to the point that in 2010, they represented 50 million people, about 17% of the US population. The most recent data indicate that it has increased to about 19% of the total US population, and by the year 2060, 1 out of 3 people will be Hispanic Latino. And in reality, when we start looking at the gaps in terms of research, very little is known about the use of tobacco product, particularly among different Hispanic subgroups. When you think about Hispanic or Latino, you're referring to people that come from more than 20 countries, either Central, South America, Caribbean, or North American, like in the case of Mexico. So this particular project is aimed to get a better understanding about the knowledge, attitude, and behavior toward diverse tobacco product. And this is important because most of the research available indicate that Hispanic have the highest prevalence of tobacco use. And when you look at different subgroups or group by national origin, you find that the Puerto Rican, 33% of the Puerto Rican reported smoking cigarette, and it goes down to about 31% for Cuban American. And then among other groups like Central South America, much lower, like 11% or 13%. So we just don't know much about the diversity of the tobacco use and how it varied by different national groups. So this particular study, we were able to conduct qualitative data. So we conduct a series of focus groups in Chicago, Miami, Bronx, New York, and San Diego. And in every city, we try to particularly reach out to a given constituency. So Chicago was primarily people from Central and South America, and New York was Dominican and Puerto Ricans. In San Diego were Mexican American, and then Cuban American in the Miami area. First of all, there was a little bit of surprises. Most of the research in this area indicate, for example, the Latina women use cigarette much lower than men. So Latina women will be close to 11%, and men will be all the way to the 30%. In this study, we found, based on qualitative data, that there was no clear differences by gender, that the social norms that we had among women, Latina women, have been changing tremendously. Secondly, that younger versus older population have different consumption of tobacco product. For example, the younger population between 18 and 30 were more likely to report the use of e-cigarette and the use of hookah, while the older Latino men and women were more likely to report the traditional cigarette smoking. So that was a finding in itself because it was alarming across the different sites, the considerable amount and acceptance of hookah and e-cigarette, to the point that in the case of Bronx, we find out clearly that even for invitation to baby showers or wedding, people are said, if you come, you're gonna find the hookah devices that you could very well use and share with others. So it's that well accepted. And there is limited knowledge and understanding about the fact that most of those emerging products has nicotine, and as a result, the harmful effect is there, but people are not aware. There's not regulation in terms of those products, and for that reason, people think that it's not danger to their health, or they think that they could use that to reduce the consumption of cigarette smoking or to stop cigarette smoking altogether. The participants were not necessarily patients, were people that represent those constituency, and so they were a total of about 200. So it's a relatively small sample, about 50 per different cities in average. And so the participants were individuals we divide them by smokers and non-smokers. So we had group discussion with people who never had smoked, trying to find out what are the protective factors, what kinds of things keep them away from experimenting or using drugs. And then we wanted to hear from the smoker to find out why do they smoke, what are the differences in terms of the use of different tobacco products, and to get a better understanding about their knowledge about the relationship between tobacco use or cigarette use and cardiovascular condition. So what we have found is that in terms of the Latino population, and we also divide them by US born and non-US born, there was clear differences. The US born use more the emerging products, the hookah e-cigarette, and tend to be a little bit more informed about the consequences of tobacco. Immigrants, first generation, they are less knowledgeable of the consequences of tobacco or cigarette use, and they were less knowledge about, for example, consequences associated with the health effect. They are less likely to use the quick line, which is the telephone hotline, to be able to get assistance for tobacco cessation and other purposes. And so we did find clear differences. Interesting, the research indicates that immigrants, when they come to this country, they tend to adopt behavior that sometimes are not healthy for their health. And what we found out is that immigrants who smoke, who came here already with the habit of smoking, were more likely to stop smoking because they confront themselves with higher costs for the cigarette. And they also find that the higher cost, but they also find that that there's so much social pressure and regulation in terms of secondhand smoking and not smoking in public places that they decide to give it up altogether. You have to target your message in terms of smoking cessation for those that are at higher risk, for example, and can very well benefit from messages that educate them about the diverse methods of engaging in smoking cessation. So that's one message. The other message was the importance of the family. The groups that did not use cigarette or any tobacco product clearly indicate that the family, the parents, really play a very critical role in setting clear norms in the home that indicate to those children and youth that they should not smoke and give them a clear rationale about the impact on their health. Those who actually smoke, they started earlier, in the pre-adolescent period. And they said that the parents were the first one who told them, go to the kitchen, light a cigarette for me, because they were smokers. And they were the one who really made it accessible, because once they start trying and experimenting with the tobacco use, then on their own, they knew where the cigarettes were at, and they would continue using it. So it clearly indicates how the family situation could be either protective or could actually encourage people at a younger age to start smoking. And then the whole issue of the peer support clearly reinforced some of the knowledge that we already have. The peer pressure either has a positive or a negative influence over the behavior of youth of youth. So those are some of the messages that we take. And clearly the need to regulate e-cigarette and hookah. You find in any place now the hookah lounges, you find that it's not prohibited to smoke, so people are using them in the workplace, in the home, in the street, in the park. There's not enough scientific evidence that clearly indicate the damage of those products to your health. But if we all know that they have contained certain levels of nicotine, and nicotine has been proven to be damage for your heart and your general health. So the regulation, the policy from the Food and Drug Administration is not there yet. And one of the reasons why this study is mandated and funded by the Food and Drug Administration, because they are looking for the science, so they could be able to come up with informed policy decision and position they could regulate products such as the hookah and e-cigarette.